Hello, everyone. I'm Vikas Sani, president of the Lown Institute. Welcome to the 2022 awards ceremony for the Bernard Lown Award for Social Responsibility. The Institute was founded by Dr. Bernard Lown in 1973. And since then, we've continued to be inspired by his vision for a just and caring system of health. We've also tried it as best we can to generate really bold ideas for realizing that vision. Many of you know about our signature project, the Lown Institute Hospitals Index for Social Responsibility. Dr. Lown's influence on the physician community and across the world was monumental. He touched many lives. So when he passed away last February, almost at the age of 100, we knew that his life and teachings would be an inspiration to countless people. We also knew that he would have been very pleased to have his name associated with the next generation of clinicians. That's why we created the Bernard Lown Award for Social Responsibility, to carry on his legacy, encourage a new community of clinicians to think differently and to act courageously. Last fall, when we opened the nominations, we really had no idea what was going to happen. We didn't know how many nominations we'd get. In the end, we had over 50. These were all reviewed and discussed by the nominating committee, and a final list was then forwarded to a selection committee, and that's how we chose our winner. So let me pause for a second just to say thank you to all the nominators of such an impressive list of candidates. I know I speak for all of us on the committees when I say that we were all truly inspired and really amazed to hear about the work that these people were doing beyond the walls of their clinical work. I also want to thank the members of the nominating and selecting committee itself, as well as the board and the tireless staff of the Lown Institute, without whom we couldn't have put all of this together. And of course, the donors, without whose support the fund couldn't have been created in the first place. So thanks to all of them. But most importantly, I want to thank the Lown family, who've been active participants in supporting this effort from its inception. So let me introduce you to Zachary Lown, grandson of Dr. Bernard Lown. Zach?
Thank you, Vikas. So my name is Zachary Lown, and I am Dr. Bernard Lown's grandson. And the Lown family was really thrilled that this award was created this year. I had never really met anyone like my grandfather in terms of his ability to make inroads on so many fronts. And so when he passed away recently, it felt like such a huge loss at such a precarious time. However, when I sat on this selection committee, I was so moved and impressed and energized by these candidates and what all of these candidates had done. The finalists included a young doctor fighting for Medicaid coverage for undocumented people in Denver. It included established physicians working to prevent limb loss amongst communities of color in the Delta. It included doctors working with coalitions of physicians and connecting them to housing activists based on the link between health and secure housing. And that's just to name a few of them. Dr. Mona Hanna-Attisha, who is a pediatrician and goes by Dr. Mona, is rightly included at the top of this list. I think that Dr. Mona embodied some of the principles that my grandfather espoused. There were many Dr. Lownisms, and so I'll focus on just one. And one of the things that my grandfather used to like to say was that every time he had a great idea, people would chime in with how difficult it would be, why it would be so expensive, and who would oppose it. And my grandfather used to say, start with the idea. Start with the idea. And if you like the idea, then we will find a way to get it done. Dr. Mona saw the problem and would not put it down until she had collected the data and exposed the harm and seen it through. So I think that she is the perfect recipient this year, and we're hope that this award inspires others to continue the work of Dr. Bernard Lown and Dr. Mona, and we look forward to more nominees and awards in the years to come.
Today is June 7th, and we chose this day deliberately. It's Dr. Lown's birthday. He would have been 101 years old today. I first met him as his chauffeur from the airport to grand rounds at Johns Hopkins. I was in the leadership of Baltimore Physicians for Social Responsibility, and he was coming back to his alma mater to give a keynote address on the medical consequences of nuclear war. Driving down that highway, I could never have imagined the relationship that was about to unfold. But over many years, really decades, after he strong-armed me to leave Hopkins and come to Boston to be his fellow, he became my teacher, my mentor, my colleague, partner, and friend. So obviously I'm quite biased, but I must say, in my estimation, Dr. Lown was one of the greatest physicians of the last century, really of any century. Now, why do I say something so bold? Well, first of all, he was an excellent scientist. As a resident, he speculated about the role of potassium levels and the toxicity of digitalis, which was a very widely used cardiac drug at the time. He then proved that when he was a fellow at the Brigham, and then wrote it up in a paper that became an instant classic. That concept that he developed was riveted into medical practice for 50 years and beyond. So he knew what science was, but he also knew what science ain't. And he was a really good doctor and a really great clinician because he was consummate in his understanding that you have to apply some basic common sense. And he did that and blew up a lot of pseudoscientific theories. That's what led him with Sam Levine, Dr. Sam Levine, his mentor, to start getting people out of bed early after heart attacks instead of keeping them at bed rest for 6 weeks. The photo shows him with a heart attack patient being put in what was called the Levine chair at the time. But I'll tell you, that practice caused pandemonium when it was presented at a medical meeting in Boston. People went nuts. It was, you're killing people. This is crazy. What are you doing? Instead, he and Levine probably saved hundreds of thousands, if not millions of lives in the next half century. In his clinical work, what Bernard valued most was the human relationship above everything else. And his patients were really the beneficiaries, and they knew it. Like many physicians, he was very comfortable talking to an aristocratic, a woman from Europe, as comfortable talking to a working class man from Mission Hill, always listening. And in fact, listening was really his superpower. He used to tell us, if you're with a patient and a bomb goes off next door and you hear it, you're not listening enough. So what made Dr. Lown so spectacularly different from so many doctors, really, was his courage. Courage to stick to his guns despite the risk. And he put his career on the line many, many times. In fact, before he became famous for his medical achievements, he was a confirmed troublemaker. He was kicked out of Johns Hopkins Hospital for transfusing a black man's blood into a white man. Oh my God, what a crime. Eventually, he was reinstated. Similarly, many people know that he collaborated with another fellow East European immigrant, Baruch Berkowitz, in developing and with the team that developed the first viable cardiac defibrillator. What fewer know is that it was done in the Department of Nutrition at Harvard. And hardly anyone knows why he was in the Department of Nutrition. And that's because Harvard Medical School, much as we love it, blacklisted him for not signing a loyalty oath during the McCarthy era. So he was unemployed for nearly a year. And only after Paul Dudley White and Sam Levine went to the nutrition department could they persuade them to take him in. And then, of course, he had the chutzpah to start International Physicians for the Prevention of Nuclear War with, of all people, Yevgeny Chezov, the Kremlin cardiologist. People attacked him for being a Soviet stooge, even as he was being awarded the Nobel Peace Prize. But I actually suspect that his brainchild, a worldwide movement of physicians against nuclear weapons, had its biggest success inside the Soviet Union because he got access to television and the media and broadcast the IPPNW message to millions of Soviet citizens. And I think that played a key role in legitimizing the eventual arms control agreements. And I suspect it helped pave the way for Gorbachev's subsequent reforms. And we know the rest is history. So even with all of his magnificent achievements, Dr. Lown was never under the impression that he could do it all himself. He always saw his work as a collective activity that had to continue on for generations. And to everyone who knew him, it was crystal clear that he valued young people the most. He valued them for their energy, for their willingness to take on the establishment, for their ability to actually shape and reshape the future. That's why we couldn't think of a better way to honor Dr. Lown than by encouraging the next generation of clinicians to follow his example. So that brings us to the winner of the 2022 Bernard Lown Award, Dr. Mona Hanna-Attisha, and I'll also call her Dr. Mona. Many of you know her name and her work, but I suspect all of you and most Americans know about the Flint water crisis. And if we look at what she did, I think it'll be obvious why she's the first winner of the Bernard Lown Award. Dr. Mona, practicing pediatrician, was a key individual who brought the Flint water crisis into public consciousness. She was also instrumental in creating the political will to address it. In fact, she's one of the reasons we all know that story. What she did was relentless. As Zach was saying, there's a little bit of that Bernard Lown, don't take no for an answer here. She was relentless from one step to the next, discovering and documenting the problem, taking action to fix it, and going step by step. Step one, review her patient's medical records. When a friend suggested she look into what was happening with lead levels in the water, she did just that. She looked at her records and immediately noticed that the number of her children with elevated lead levels had doubled since the water had been switched. Then, commendably, she stopped to recheck the work and recheck it again because she wanted to be absolutely sure before she went public. And like many professionals and professional physicians in this context, she consulted her colleagues and she shared that information. Then she collaborated with clinicians in the community to get the word out. So just like Dr. Lown with the nuclear issue, she then organized a press conference with her colleagues to reveal the findings. And it was this group, not politicians, who called for the immediate switch back to the Detroit water system. Many of you will know that when they did that, government officials first tried to discredit her. But Mona refused to give up. She kept going. Even after the governor declared a state of emergency, her work was not done. She didn't stop. And she didn't just go back to the clinic. Instead, she kept fighting for her community all the way to the halls of Congress, where she testified about the urgency of this matter for the health of her patients and for the communities. And she did that while being gaslighted and being dismissed with sort of authoritarian criticisms of the work. And so while in retrospect, this was a clear and logical sequence, it was nevertheless extraordinary. I mean, what her example tells us, what her example teaches us, is that knowing right from wrong, sticking to your guns, letting the chips fall where they may, all of that is necessary if you're going to be a good citizen. And her example teaches us lessons that matter to all of us, teaches us that we can all find a path for taking a stand, for breaking the rules when it matters the most, and being a troublemaker, the kind of good trouble that John Lewis famously talked about. So I have absolutely no doubt that Dr. Bernard Lown would be delighted to see her become the first recipient of the Bernard Lown Award for Social Responsibility. Mona, why don't you join me up here? Thank you so much for coming here. So Mona, I just have to say, you know, we need, and the entire country needs, more doctors like you. We need them to step up like you. We need them to be brave with dedication, to be relentless in defending the health of our patients and our communities. So I'm so pleased to be able to give to you the Bernard Lown Award for Social Responsibility, along with a check for $25,000 to support your work. Thank you so much for being here. Yeah.
Wow, wow, wow. I am absolutely honored and humbled. I have so many thank yous. Thank you to Vikas. Thank you to the Lown Institute, the incredible staff at the Lown Institute, the Lown family who I've had the privilege of meeting over the last few days, to all those who are part of this nomination and selection process. Thank you, thank you, thank you. This is such an incredible honor. Happy 101st birthday to Dr. Lown. I love birthdays. So, you know, in some ways as a pediatrician, it's kind of my job to make sure that kids have as many good birthdays as possible. So much of my job as a pediatrician is making sure like kids are healthy today, like we treat them for their sniffles and their broken bones. But really my job as a pediatrician is about making sure that kids have even better tomorrows, that they can have as many of those good birthdays to come, from like vaccines to, you know, injury prevention and, you know, wear a car seat and eat healthy. It's all about the tomorrows, the more good birthdays that we can have for our kids. I'll tell you a quick story. I was in clinic a couple weeks ago, and one of my favorite questions I love to ask children is, what do you want to be when you grow up? And I had a little girl come in for her 4-year checkup, and I asked her, I'm like, what do you want to be when you grow up? And she looked at me and she said, I want to be 5 when I grow up. That was awesome. And I want her to be 5, and I want her to be 6 and 7 and 8 and get up to 99 and beyond and have amazing birthdays. But as Vikas shared in Flint, there was something in our water that was kind of threatening the tomorrows, the birthdays of an entire population of children. So, you know, one day I was a pediatrician taking care of one cute kid after another, asking lots of kids what they want to be when they grow up, giving out fist bumps and high fives and stickers. And the next day I was kind of facing the dire needs of an entire population of children, because with every baby bottle, every sippy cup, every glass of water, my kids, my Flint kids were being poisoned by their drinking water. And I had a choice to make. Would I keep my eyes closed and go about my busy business? And I was busy. I was a pediatrician, a professor, a residency director, a mom, a wife, juggling a million balls in the air, just like so many folks do every day. Or would I stand up and do something? And there really was no choice. From the moment of knowing about the possibility of lead in the water, there was no unknowing it. It was a choiceless choice. I could only go forward because there was too much at stake. It was about my kids and their birthdays. But making others see was a whole other thing. I ran up against people and entire systems that were built not to see, even when they did know that there was a problem. And it was almost like this indifference, this willful blindness to certain people and places and problems. And no matter how scary and how hard it seemed, I couldn't close my eyes. And that makes me think about Dr. Lown and all the amazing things that he did in his life, because throughout his life, he couldn't close his eyes to injustices that were threatening the health of not just his patients, but of people everywhere. He saw a problem and he couldn't unsee that problem. It was only about going forward, finding a solution with science and also with stubbornness. And I've got to hear more firsthand about his stubbornness. And I love that because I'm absolutely stubborn. And I leaned into that single-minded kind of science and that stubbornness. And my doctor role quickly shifted from clinician educator to detective scientist to patient advocate. And even as I offered up that scientific proof that yes, lead, a poison, was increasingly in the bodies of our children, my research was met with denials and attacks. For a quick minute, I regretted using my voice. I was scared. I felt defeated and tiny. I began to second guess myself. After all, I was just one person, one doctor, a small, you can hardly tell, I'm like barely 5 foot tall, a small brown immigrant woman going against really powerful forces. And I thought to myself, maybe I should have just stayed in my lane. It would have been easier to keep my eyes closed and my voice silent. But I quickly realized this wasn't about me at all. This was about my kids, right? My kids and their birthdays. Whether we knew it or not when we started, by taking on a life in medicine, we have placed ourselves on the front lines of some of the most important battlegrounds of society. And Dr. Lown knew this. Our work is about standing on those front lines every single day against sickness and disease, but also holding those lines against injustice and apathy. And sometimes that means being on guard for a city that's being poisoned. And sometimes that means holding the hand of an isolated COVID patient whose life is slipping away. Sometimes that means, late nights in the lab trying to figure out how to prevent sudden cardiac death. And sometimes that means trying to stop nuclear warfare. Dr. Lown understood that our work is about people. It's not about the power or the prestige or the paycheck. It is about people, the people that we are privileged to serve. He also understood that our work is not restricted to the bedside nor the bench. It's not just about providing direct patient care to the people in front of us, but it's also about seeing beyond the obvious and addressing what truly makes our patients healthy. And I think what Dr. Lown understood the most was that for those of us in medicine, we kind of have a superpower. Our voices are powerful, they're privileged, and they're credible. When we speak grounded in what's best for our patients, people listen. I walked out of my clinic and my MD behind my name was a megaphone for the kids of Flint. And I used it, and I was loud, and I was stubborn and persistent. And it was the voice of medicine that ultimately changed the trajectory of an entire city. And I haven't let go of that microphone, and I'm going to hold on to it as long as I can to help as many kids as I can, because it's not just about Flint. There are kids and communities everywhere poisoned by inequities. And while I have this microphone a little longer, I just want to share that this incredible honor is not so much about me, and it's not so much about Dr. Lown either, but really it's about you. It's about all of us, and it's about who we want to be. Our collective work is unfinished. We have a lot of health injustices, a lot of big problems that still need solving. We need you. Big things like eliminating poverty and eradicating racism, narrowing inequality, reversing the climate crisis, preserving our fragile democracy, ensuring healthcare for all, protecting women's reproductive health right now, and ending gun violence. These are all things that are making our patients and our communities sick. These are some of those upstream threats, those root causes that are making people sick. And rather than making the right diagnoses, we too often reactively Band-Aid. And our communities cannot afford to have the guardians of health, those of us in healthcare, shut their eyes, look away, and stay silent to injustices that threaten the health of our patients. And I know all this sounds kind of overwhelming, and I want to share something that Dr. Lown said. He said, "Great as the present danger is, far greater is the opportunity." My story is about turning a crisis into an opportunity. It's about wielding that superpower that we all have in medicine to walk outside of our hospital and university doors, to challenge the status quo, and to make a difference in the world. And it's happening everywhere. I see it happening everywhere. Every day I am inspired by folks in medicine bravely facing their present dangers, big and small. And we heard about all the amazing other folks that were nominated, all these people, all over, hundreds of them, doing amazing things, turning these present dangers into opportunities, opening their eyes to the inequities that are all around us, inequities that make our patients and communities sick, and standing up bravely for justice and opportunity and democracy and equality. I think Dr. Lown would be proud. There are hundreds of people deserving of this award. I know this award will continue into perpetuity because there are so many amazing folks doing amazing things, but we need hundreds more. Imagine a movement of doctors and nurses and all our partners in healthcare united for structural change. So as we celebrate Dr. Lown's birthday and this humbling, incredible recognition, I hope it all leaves us inspired and committed to a tomorrow that is healthier, more equitable, and more just. And a tomorrow with more kids in more places celebrating more birthdays. Thank you so much. Thank you so much.
Mona, thank you so much for your remarks. Very, very moving. So thank you all for joining us, and thank all of you who are doing incredible work, continuing that work. Let's do what we can to make a difference in the world, like Mona did in Flint, like we all need to do everywhere we are. So we're really excited to do this again next year. And in June, we'll be celebrating another amazing clinician. So the nominations for next year are not open yet, but if you visit our website, lowninstitute.org/subscribe, you'll get all the latest news of the Bernard Lown Awards. And when those nominations are open, we hope you'll be submitting some names. So for now, thank you so much for joining us. Thanks, everyone. Thank you for being with us, Mona. Have a great afternoon, and we'll see you next time.